let's dive into the criticality of cybersecurity and data protection in the healthcare sector. It's my honor to welcome our opening speakers, Dr. Arvind Shivaramakrishnan, CIO at Karkinos Healthcare, and Mr. Vinayak Godse, CEO DSCI. Let's hear from them as they set the stage with their opening remarks. Over to you, sir.
Thank you, Sapna, and thank you all for joining. Probably this is the first time that we are doing this interaction to bring the people from health sector and more importantly those who are working with health sector, right? So, and we all know as a country we are in a way giving quite a good guidance and probably narration to the global economy in terms of how to digitize economy, right? So we did that through Aadhaar to start with, but then especially in the financial sector with UPI, the kind of revolution that we brought and kind of scale and volume at which that we have been able to do this digitization. And while doing that, we also democratize it basically. So means we are able to see somebody, even Google and Facebook and Amazon joining to initiate transaction while working with the legacy banking ecosystem, and at the same time it is also a lot of startup in fintech area. Means fintech ecosystem in India is quite growing well. So while we brought this architectural intervention through the UPI for that matter in the financial sector and created this revolution in the country, right? And in every financial sector there's an innovation that is definitely a story for each of the organization that they're trying to make use of technology, they're trying to build those applications to improve the experience, to improve the productivity and also bring some new possibility, right? And while doing that, every sector is different. I mean, the sector like financial sector, they are largely working on IT, but the sector like oil energy sector that we look at, they work on physical environment and they try to digitize more physical environment. And there is a sector which is, for example, government sector for that matter, is largely putting those application on a public forum and digitizing the public services delivery basically. And then the sector of health sector is a story of everything. Means there's IT story, there is a OT story as well because you are bringing a lot of those devices, IoTs to the digital form, and there is a story of a critical security, infrastructure security story, there is a story of a AI that is getting practiced a lot in AI sector. And all of these innovations, the way it is happening, so the threats and the kind of possibilities that we are opening in IT system, we know that kinetic impact is very difficult to bring it in those sectors because you can quickly recover your competing systems, right? But in sector like oil energy, sector like health sector, the impact will be quite significant. And you will bring, probably to lead to kinetic impact. So the impact which is very difficult to recover from. For example, there are a lot of things that we see in ransomware for that matter, and we have seen some of the examples in India, right? How the operations got crippled because of the ransomware attack, and how the entire delivery of those critical services become very difficult, right? And especially in the pandemic time, we are seeing kind of attacks which are happening in the health sector. And also we see the health sector is the one where technology is the way to provide those capabilities to the different set of population, right? One is definitely taking care of your population, but we also see India is now leading destination for providing health tourism for that matter. We are providing a lot of those kind of health services to all the global geographies, and there are almost million plus people travel to India to get access to health services here. And now technology provides an opportunity to serve them remotely as well, right? So when it's all happening, where there's a story of IT security, there's a story of data security, there's a story of a device security here, there is a story of a security of a application network specific to the hospital, a specific story with respect to the devices. For that matter, there is a question about supply chain issue, and that is devices story. And there is a story because we are also trying to try to bring this digital public infrastructure or this aggregate level infrastructure to the table because of Government of India looking this sector as a very important sector from the technology intervention perspective, and use technology to improve the health service delivery in the country, to reach out to the remotest part of the country, and also at the same time make sure that we lead in terms of the innovation in this sector basically. When this all happen, we all know when we digitize, we keep our footprint open, and there's a possibility that we create for attacker ecosystem, and attacker ecosystem has come to a level where a small vulnerability, even exposed for a moment, is likely to get exploited. So that's the attack ecosystem that we are into, right? And when there is a complexity on one hand, and there is a complexity at the aggregate level, these interfaces that we need to look at, then managing affairs of security, privacy, and overall governance becomes very difficult, right? So this today's health care sub-summit that we set up is to come together and deliberate on various different approaches, very different standards, very different work that is happening globally, and plus your own experiences as well, and see how can we take those. Definitely regulation is important part, standard making is important part. We have somebody from SEDAC which is engaged with MHA on standard making for the health sector. We'll probably have somebody from National Health Authority also coming to us, and look at how things are seen from the security, privacy, now ethics perspective as well, right? And the different planes that we talk about. One plane is definitely security, safety, and crime. And health sector and crime is now, digital crime is becoming a very important area. Second is the trust, and trust is largely privacy. In last 2 years, we have been delivering a lot in this country in privacy. And third is ethics, because data is becoming very important. A lot of news yesterday, only there was a news about neuroscientists, the AI is predicting much better, and they are replacing some of those kind of capabilities that the doctor can bring to the table, basically, right? And how can you make use of that? So on that context, on that backdrop, so this sub-summit is taking stock of that, see, evaluate that from these different plane I just talked about, and see the experiences that each of you are bringing here. We have health tech provider here, we have hospitals here, we have global health capability being delivered out of India here. There are people from standard making. Sir is here from Mizoram IT. He is leading that. He's a secretary Mizoram IT, and then in that ecosystem, I think health sector is definitely one of the important areas that we must be looking at, and we'd like to hear your comment that how in the Northeast area, how things are evolving from the IT perspective, and how you are grappling with some of the challenges there basically. So with this agenda in mind, we thought about putting these different sessions together in this sub-summit, and in a way that it should more dialogue based. We want to get your views and inputs and your comments as well to the content that we bring together, and then create an effort so that we mobilize the effort of a health sector, security, privacy, and ethical part from a data governance perspective more aggressively from now. And in a way that it's not every time we seek for regulation, it's not every time we are seeking for regulatory intervention or pressure to improve on. So sometimes something can happen from the industry itself basically, and regulation can follow. Sometimes regulation may create a problem for us as well if you really rely too much on regulation. So how can we find agenda at industry level for security, privacy, and ethics nowadays? So to put it all together, we thought about the sessions here, and we really thankful to Karkanas, HIMSS, and Chime for helping us to put this together, and look forward to very detailed kind of deliberations. Which should take us to the next level basically. So this should be feeding to the effort that we can put together in the next future, and that's why we are talking how can we make this as a kind of effort, and we are also discussing with different hospitals as well. I was there in Bangalore where we had all the CEOs and MDs of hospital came together, and they asked me to talk about what we have been doing in cybersecurity space. There is a separate group of the MDs of hospitals, administrative wings of hospital. They came together, they invited us, what can we do from the security privacy perspective. So all of those things are happening. A lot of awareness definitely is there, but some of the areas, like for example, there is always a leader in this, right, or early adopter in this. But there is always a challenge with respect to, for example, I recently engaged with some government hospitals in different states basically, right. For them, there are a lot of challenges they see. So small hospitals, the way they work basically. So there's a scare, there is a problem, there is a concerns, and how can we, while we do deliberate on this, how can also see some of those segment of this ecosystem which probably are a little bit, it's not a good word, but cyber poor for that matter. Right? So they are not having those resources and the understanding to invest adequately in cybersecurity in health sector basically. So how can we also reflect on those challenges is something that we like to look at, and that's what we expect this deliberation should have. And we expect all active participation from the participants here, and we like to capture these interactions, so put together some kind of a plan for us for the next year or so in the commission. Thank you Arvind sir and HIMSS and the CHAM community for helping us to putting this together. Thank you.
For those who don't know me, my name is Arvind Shivaramakrishnan. I'm the CIO at Karkinos. Today's session is not going to be this way, but more like the 9 o'clock TV news debate. So we'll try to stir up as many controversies as possible so that we get a lot of heated responses. The audience around this room is a combination of personnel representing different industries. We've got the IT secretary from Mizoram. We've got the defense forces here. They're much more organized, and they're coming and expecting organized answers, which let us hope we don't disappoint them. We've got our colleagues from Asia Pacific who will give us what's going on across the world, provider colleagues and those in the consulting sector. All of this aimed to trying to find answers. Today is not a session where we are giving out the answers, but we are in the quest of answers. Because genuinely speaking, in healthcare, we've still not formulated the ways we need to work. While we can learn from the banking and the manufacturing sector, we've seen them organized, we've seen them work through, healthcare is not that way. Why is it not that way? I just can blame COVID for it and say COVID should have come earlier, but if I make that controversial statement, I don't know what will happen, so let's avoid that. COVID brought to light the need for capacity. A land of 1 billion people, we look at the capacity of healthcare that can serve all of us with an alarming rate of non-communicable diseases. Physical capacity is not possible. Now with this scenario, you bring in technology. You bring in technology with the intention that it will scale and reach 1 billion people. And then come the bad actors who can start infringing on it, and the pristine healthcare that people trusted us with stands compromised. Knowingly, unknowingly is a different matter. When a compromise happens, a compromise happens. And the trust between the consumer and the provider is broken. When that trust between the consumer and provider is broken, the entire delivery ecosystem fails. This is the alarming consequence of what happens with healthcare. So our intention is to figure out how security and privacy can be that DNA and fabric that binds healthcare delivery together. So in today's sessions, we will be hearing on the best practices that are going on in Asia Pacific and how models of maturity can be put into evolving that. We'll be hearing in terms of standards that have evolved in India, that have been worked out in India for healthcare delivery to happen. We will be hearing also from a nursing perspective. Why a nursing perspective? Because ultimately the soldiers on the ground are what are the last mile connectivity between the healthcare and the patient consuming that healthcare. And how is that actually happening, and how does it need to happen? It's happening today, obviously. There is no breakdown in systems today, but is that something we can sustain? Clearly not. Clearly not. Just our size, shape and dimension cannot. And we are in the quest of always expecting, demanding and wanting excellence to be served at us at our point of recall. How do we make that happen? We will be having a discussion on patient-centric innovation. And why did we pick this topic, patient-centric innovation? Because the easiest one is say there's too much of complexity with cybersecurity and privacy, so let's shut down shop. and just do status quo is a method. Nothing wrong in approaching that, but are we going to scale? So we thought we'll bring that in. During this course, trust me, we've got all your names. We will be pulling you up for comments. So we will be so we would only request that the comments come voluntary as opposed to it being pulled out. But that's our intention of ensuring that as much of all of this is interactive. We intend to make a paper on this so that we can continue this dialogue. Otherwise, more often than not, we talk, we forget, we feel about it passionately and go nowhere. So this was our first session. We really thank all of you for making it here, because initially when we planned it, we had a very few set of chairs because we didn't think too many people will come in. So thank you very much for breaking that confidence and actually making it a room where we had to bring in more chairs. So thank you very much for that. We look forward to wonderful deliberations today. Thank you very much. Namaste.